So, good afternoon, everyone. My name is Scott Ryan. I'm the principal for the Beaverton Early Childhood Center with Northwest Regional ESD. And this is our March Caregiver Connection activity. It is being recorded, and we do have Spanish interpretation available. Carlos? Great. Thank you, Carlos. So today we are fortunate to have Kim Medlin. She works as the teacher for visually and blind impaired students. She is absolutely wonderful in the work that she does, and I got to see that firsthand at the Harvest Festival where she hosted sensory integration room, as well as she is the host of an annual carnival for students with visual impairment. And so we're fortunate to have her join us today. I'm going to go ahead and go off screen, and I'll go ahead and pass it to Kim.
All right. Well, thank you for joining us. This is the first time that I've been able to do a presentation for parents this year. So I'm glad that you were able to join us. Because of I'm going to say our short time frame, I overplanned. And so there are more materials than I will be able to cover, but you will have access to the PowerPoint um, soon. I would say after spring break, it should be ready to go. All right, so we're going to start with a video.
Your eyes allow you to see the world around you, but have you ever wondered how they work? First, it's important to know that vision depends on your brain as much as on your eyes. Your eye's main job is to detect patterns of light. Then, they work with your brain to turn those patterns into images. Let's take a closer look. Light rays bounce off an object you are looking at. Let's say the object is a dog. The light reflects off the dog to your eye. Then, the light enters through the outer part of your eye, called the cornea. The cornea is clear like a window. It helps your eye focus the light to make things look sharp and clear. Next, the light rays pass through an opening called the pupil. The pupil is the dark round circle in the colored part of your eye. The colored part is called the iris. It controls how wide the pupil is and how much light can pass into your eye. In bright light, the iris narrows the pupil, reducing the amount of light that enters the eye. In dim light, the iris widens the pupil to let in more light. All of this happens automatically. Behind the iris is the lens of the eye. It helps focus the light coming into your eye so you can see things clearly. The lens flattens so you can see things that are far away, and bends so you can see things up close. When the lens, cornea, and pupil are all working together properly, they will focus light on the back of the eye. That's important because lining the back of the eye is the retina. There are about 130 million tiny cells in the retina that are sensitive to light. When these cells detect light, they turn it into electrical signals. Those signals eventually make their way through the optic nerve, which is like a cable connecting the retina to the brain. The retina helps create a rough image, but it sees the world upside down. It's your brain that turns what you see right side up. Also, when you look at an object, each eye gets a slightly different view of the world. The brain combines those views and makes them into one picture. The brain also adds a lot of details to your vision, so that you can see complex shapes, movement, depth, and a rainbow of colors. And of course, the brain connects your sense of sight to things you already know, so that when you see a dog, you recognize it as a dog, and not a cat or a monkey. And that's how you're able to see. To learn more about how your eyes work, visit nei.nih.gov/kids. Your eyes.
Okay, great. So as we go on, if you have questions, please feel free to jot them down, and afterwards you can email them to me. But I'd like to start out by just emphasizing how important vision is across all development. And I don't know, those of you that are here, if you have a child currently with a vision diagnosis, or if you are here just curious about vision and development, but we're going to cover both. 75% of what our little ones learn happen within the first 5 years. So if there is a vision delay, a vision diagnosis, the earlier it can be diagnosed and support found, the better. Okay, so let's go ahead. I want to make sure I don't go too fast for our interpreters. So if I do, please send me a chat message. These slides right now, this one where I discuss really what happens between birth and 4 months, I am going to take this slide out. You'll be able to read it in the PowerPoints later, but again, there's other information I want to cover here in person. So if you have a child birth to 4 months, here are some activities that I suggest. Using a night light. This is something I picked up at a dollar store. I'm not going to tell you the name of that dollar store. But right here, the colors change. I don't know if you can tell that, but it shines up on the wall and in the ceiling. That's a great idea. Using bold colors, contrasting colors, black. Now, quite many children, babies will respond to black and white. There are some children with a visual diagnosis called CVI, which I will address. Black and white is not something they respond to. We might want to add colors to these pages, especially black or red or gold. Make targets, things the children are looking at, make them predictable. So for example, you might always have yellow bells hanging on your door. Keep them there. Though the children learn when they see maybe maybe you have a green picture in the hallway that you walk by as you're going to the bed, the crib. Leave that there. The children learn to recognize that symbol, that color, and they can know where they're moving. A mobile with bright colors, textures. So here's an example. This is something we made, again, just using dollar store objects, things with textures. It's all about touch at this age. Same for books. You can get lots of touchy-feely books. You can pet the ear of the puppy. Those are great. Any toys with textures. Here's one that we purchased, but you can do the same thing with homemade toys. Just get objects from around your house, sponges, different fabrics, a little metal spoon, and let the children touch that. You don't have to go spend money on these overpriced toys. As you're walking with your child outdoors, in the park, through your house, describe what you are seeing. Oh, there's the red fire truck. The red fire truck is so loud. Also, when you're feeding your baby, not just for because for breastfeeding we go left to right, but it gives the child a different perception where they are in space. Okay. Then we did the 5 to 8 months. Again, you can read that on your own. Here are some activities. Hanging a mobile where they can pull and grab. For some children that need that contrasting color. So if this was in the crib, You can see I added some sparkly red fabric, red tape, again, to draw attention because this was just black and blue. There wasn't a lot of contrast until I added that. We want all of their senses to be awoken. So smell, taste, touch, hearing, toys with sound. In fact, most toys that have cause and effect buttons have sound also. We want textured toys. We want toys they can hold in both hands to bring to midline. This is where you might do the patty cake, the peekaboo, the eensy weensy spider. They might not be able to do it quite yet on their own, but it's good to have that exposure. I wanted to show also a toy here. I have my Slinky dog. Let me plug it in. So Slinky dog lights up. I managed to find this at a Goodwill. And so this would be a good toy for floor time. So how do we bring visual attention to objects? Think about that as well as the other senses, the touching. All right. So 9 to 12 months. Here are some skills that typically occur at this age. Well, how do we help them with crawling? How do we help them maybe to roll a ball? Well, here are some activities. Hide and seek. So we have colored scarves from the dollar store. We have this apron. I don't know if you can see it. It's a child-size apron. And just different textured items have been attached with cheap shower rings. So you want the contrast in color and you want texture. So here's a little cushy ball, the scarf, and I also attached a light to it. This apron with these textures would be good for any of the ages. When we were talking about crawling, some pool noodles, you could lay these out on the floor to give the child a target to move towards. And again, you want contrasting colors. Pool noodles, cheap, easy to use. Mirrors. Mirrors are important for all of the ages. So here are some mirrored blocks. You can practice stacking. You want the children to look at their images. You can teach the touch the nose. Where are your eyes? And these are all stacking. They were not cheap. So I'm thinking, how could we make this on a budget? Well, can you put, even though it won't be exactly like a mirror, could you put tinfoil on regular blocks? Glue them. All right. So rolling a ball, you want, again, contrasting color, maybe a bright red, a bright green. For children that need an auditory cue, you can attach bells to the ball. And as it rolls, they can hear that. Yes, they make those balls for an expensive price. Can make your own. I forget the name of it, but the balls that have openings that are easy for the children to grasp, you can put bells in there. So that's a good one. I wanted to show also taking bowls, metal bowls, because they're have a great sound as you're hitting them. We put in some lights. These are just little candle lights. You can Velcro it and put in some balls, like wiffle balls, and they can see the reflection of the balls. They can see their own reflection. But then do some cause and effect games where you are having two bowls. You put a toy underneath and you do the mix, move the bowls around and see if the child can follow it visually, look up and find the toy. For children that need, that have a visual delay or a vision diagnosis, you might want to get a light like this and put a slinky on it. I get great attention from using this. Can they follow it? So you want to go side to side, play games up, play games down. And it's just hot glued. Hot glue a slinky to a puck light. Reading stories from birth. Expose them to these books that have textures, expose them to rhymes, expose them to stories about you make up stories about their environment, about what they did. So if you went shopping, you can make up a story about shopping. You can create, make your own book. So let's say you're going to the park. Well, collect some leaves, collect some flower petals, collect some tree bark, and make, we call them an experience story. So you can revisit that, that activity. You can retell that story over and over. When we play, especially when there's a visual diagnosis, we want children to touch. They're going to use their other senses, like I said, the hearing, the touch, that's easier versus using their vision. So toys that make noise, toys with those different textures and sizes and shapes. And at the bottom of this page, the Paths to Literacy website that I put here has so many activities that you can do at home. Excellent resource. So you might want to keep that in mind. Here are some other activities to incorporate your 5 senses. The box that I talked about, the one that's quite expensive, make it out of a Kleenex tissue box and put the objects from your home, or tie together fabrics that feel different, tie them together and let the child pull them out of that box. Sound shakers. You can buy them, but you can make them. Fill, again, dollar store, fill different plastic jars with beans and dried peas and popcorn kernels. You want to hot glue it so there's no chance that it would open and be a choking hazard. But let the child listen to those different sounds. Scent jars. Again, plastic containers where you might take your cooking, like extracts, vanilla, peppermint, lemon, just different spices from your home, and let the child smell those and talk about when you're cooking. Talk to your child about what you're smelling. Taste, of course. I talked about the nature books. Oh, are you somewhere? Sorry, someone is coming. Sensory table. So little plastic tub with sand or cornmeal or oatmeal. Please disregard water beads. There was news that came out yesterday that stores, they have found that some water beads coming from China have a very dangerous chemical in their water beads. So stores are being told not to sell water beads anymore. So nix that. But lots of experiences. Again, we learn from our smell, our touch, our sight, our hearing. So give them a lot of different sensory exploration. Audio books. So for children that are blind, we want to really emphasize the sound. And so audiobooks, good for all children, as a matter of fact. You can rent them from the library. And then our tactile books, the ones like this, where we can touch the puppy's fur. Textured books are also fairly easy to make. It's the time factor. Okay, so now, is my child's vision typical? Here's an example of what you should be asking yourself. Is your child interested in what is around them? Are they looking? Do they have their eyes closed? Do they get irritable, fussy when you're out at Costco in a busy environment? Does your child look at you, make a direct eye contact, or do they always turn away from you? Are they smiling? If you make a funny face, do they laugh? Do they try to copy? How about, does your child reach out? And does the child, if they're reaching out for this, do they get it or do they miss it? Is your child interested in books? Are they meeting milestones? The walking, the feeding themselves, the speech, are those on target? And we're going to, in a moment, I'm going to show you how those, if you're saying, no, my child isn't doing that, what do I do? And I'm going to address that. First eye exam, eye doctors say by 6 months of age, if you don't have concerns. This is like just typical, no concerns, should still have their first eye doctor visit at about 6 months of age. If you have eye concerns, please set up an appointment with a pediatric eye doctor. You don't want a doctor that has adult patients primarily as the person to look at children. The training is different. The sooner you reach out to us for support, the better. So here's why, these are clues, risk factors for being concerned. If your child has tears all the time, if the eyes are not draining, if they're red or crusty, if the eyes turn in or turn out often, when they're young, newborns, it's common. But as they get older, those eye turns should not happen all the time. Sensitive to light, out in the sun, in a room, do they, on the opposite, do they stare at the lights or do they keep their eyes closed? And again, if they're not meeting those milestones, please reach out to us. See a pediatric ophthalmologist. This slide is extra important to me because we see this diagnosis called CVI. It means cortical visual impairment. This often gets missed because the eyes look quote unquote normal. And it's the behaviors that indicate CVI, as well as birth history. So if there was lack of oxygen at birth or a blood flow issue or trauma to the brain, such as a brain bleed, those are risk factors that really need to be referred to us as soon as you can. Is there a history of seizures? Is there damage within the brain with the white matter? Maybe the white matter is missing. Maybe there's a thinner amount of white matter in the brain. Was there a stroke? This could be a mother stroke or infant, baby, newborn stroke, or it could be in utero stroke. Was there an infection, such as something called CMV or meningitis? Is there a structure abnormality, meaning is the head large? Is there fluid on the brain? Is the head smaller than typical? Is there a metabolic condition? And that has to do with growth. It has to do with the feeding. It has to do with how the body is breaking down or absorbing nutrients. Is there a genetic or chromosomal disorder, such as Down syndrome, for example? Was there an accident, such as a near drowning or choking, a shaken baby? Is there a brain tumor? Was there alcohol or drug exposure? All of these, even one of these is a red flag of CVI. A doctor can say to you, and I really please hear this, a doctor can tell you everything is fine. The eyes look great. Please understand they are looking at the front of the eye and what's behind the eye, like what we saw in that video. A vision teacher is looking for how the child is performing, how they're playing, how they're developing. And so we're looking at two very different things. And so a doctor often will miss CVI. So if you have any concerns, please let your service coordinator know. What are we seeing here? And I don't, if it's possible to unmute yourselves or draw just in the chat. What do you see? You can see some colors. You can see some shapes. But really, can you tell what this is? What if I show the next picture? Can you see it now? Can you see it here? It's the same image. This one is turned upside down. I can see the cow immediately here, but I've been doing this many times. It's when we point out and draw around it, we're like, oh, wow, of course, that's a cow. This is what CVI is. We see shapes, we see some color, we have no idea what it is until someone adapts, uses another color, shows the shape. In red down at the slide, seeing is not the same as understanding. Real important to understand. So this is not to scare you at all. I would rather err on the side of caution and say, yeah, I just want to make sure that my child is understanding. I want to do some play activities like Kim mentioned. You I notice that my child doesn't look at me or looks away or closes their eyes when there are lots of things to see and lots of sound. Just pay attention to those things. And as a vision teacher, we go into the homes and work, teach you as parents how better to support your child if there is a vision concern. So that was a fast 30 minutes. And I thank you so much. Like I said, the PowerPoint will be available. I'm you talk to your service coordinator if you have questions for me. I work here at Beck. I work at Heck in Hillsborough, and I'm affiliated with Tech and on the coast. So thank you so much. And I don't know, Scott, were you going to close us out?
I will. So again, thank you so much, Kim, for coming and sharing today. And for those of you that have attended, this will also be available on our YouTube channel, probably after the week of April 8th, as we're moving into our spring program break. So once again, thank you for being here today, and have a wonderful spring break. Thank you so much. Bye-bye.
Thank you, everyone. Bye-bye.